Hey everybody, welcome back to another session of Do It Right with Dr. Ansu. That's me. First of all, can I just say thank you for all your support and encouragement, especially in the last few weeks. I've been getting some great feedback about what people have been learning from these videos and how some of the treatment has been helping them. And it's just been very encouraging to hear. So thank you so much. It definitely makes making these videos worth it. So today we're going to be talking about something that I quite often see in the office and something I deal with myself from time to time, and that's plantar fasciitis. So can I just start off by saying that we don't give our foot enough recognition and appreciate it for all that it does. Our foot is comprised of 26 bones, 33 joints, over 100 ligaments, and 19 muscles just within the foot. That doesn't even include the 10 muscles that are surrounding it that help function. That is a lot of anatomy going on in that tiny space, and we just kick around and jump on it like there's no big deal until we feel the pain. If you have experienced foot pain, or particularly heel pain, worse in the morning when you wake up and put your foot down, or after a long period of being sedentary, if you've been working for a long time and kind of get up and put your feet down, and if you feel that burning, throbbing pain on your heel, chances are you're experiencing plantar fasciitis. It is one of the most common foot problems that's seen in the outpatient setting, and approximately 2 million Americans deal with plantar fasciitis. The good news is there's osteopathic manipulation for that, and I hope to share that with you today. So let's get started. So what is plantar fasciitis? Whenever you hear the term itis at the end of any word, it's talking about inflammation. So when we talk about plantar fasciitis, we're talking about inflammation of the plantar fascia, which is this tissue that runs right underneath the bottom of your foot, which is called the plantar aspect. So if this is your foot, the plantar fascia runs from the heel, which is the calcaneal bone, and runs all the way up to the bottom of the toes, which is the heads of the metatarsal bones, and it just holds on and provides a bridge between these bones. It has few functions, including giving you arch support. So if you are somebody who has a low arch or high arch, chances are you are at a higher risk for getting plantar fasciitis. It also plays a role in shock absorption with all the strain we put on our feet. So, if you're standing on your feet all day long, or if you just picked up running or jogging and you're experiencing foot pain, but not quite taking care of your feet, chances are you are putting yourself at a higher risk for getting plantar fasciitis. So what happens when you pick up these new activities is that the tissue undergoes injury because it's getting these micro tears in the collagen of the tissue where it's attaching to the heel. So over time, these repetitive movements, these repetitive activities cause a series of micro tears, which result in inflammation, because our body's way of responding to any injury is inflammation, and that inflammation leads to the pain and discomfort that you feel in your heel. So what are some of the more common causes of plantar fasciitis? As I mentioned earlier, it is due to repetitive activity. So if you are somebody who's an athlete, for example, you're running, playing a sport where there's a lot of jumping involved, a lot of foot and activities involved, you're putting yourself at a higher risk of experiencing plantar fasciitis. Frequent walking, prolonged standing. If you're somebody who never did some of these activities and is starting to do them, they all put you at a higher risk for getting plantar fasciitis. But those are not the only causes. Your risk increases with age. So if you're not an athlete, chances are somewhere between 40 and 60, you have a higher risk of getting plantar fasciitis. Obesity is a huge risk factor because the more weight our body is carrying, the higher pressure our foot is feeling. Bone disorders such as osteoporosis or osteoarthritis or even rheumatoid arthritis can put you at a higher risk for plantar fasciitis. Structural disorders such as a discrepancy in leg length, such as short leg syndrome, or as I mentioned earlier, a high arch or a low arch can put you at a higher risk. Tightness in the musculature around your foot, so your calf muscles, your hamstring muscles, and cause your foot to prefer a certain position, which can lead to tension in the plantar fascia, resulting in plantar fasciitis. And finally, there are other extrinsic factors which are not causes of plantar fasciitis, but don't help if you're developing plantar fasciitis, such as wearing improper footwear, not changing your shoes frequently, running on unyielding surfaces, or excessive training. So what are some of the common symptoms with plantar fasciitis? We've mentioned a few already. One is that heel pain worse in the morning, which gets better throughout the day. And if you can think about the mechanism through the pictures, it's this tissue that lies right underneath your foot. And at nighttime, your foot curls up, the tissue is relaxed. Well, in the morning, as you stretch your foot out and put that foot down, there's a lot of tension that's building up in that tissue where it's pulling on the heel, and repetitive pressure as you're walking down causes it to get inflamed and causes that discomfort. But it does get better throughout the day as you keep moving and cause a proper stretch of that tissue. There's also point tenderness right where that fascia, the plantar fascia, is attaching to the heel, which can be worsened if we just dorsiflex the toes, which is just pushing the toes backward, which causes that pain to come up. It is very typical of plantar fasciitis as well. About 1 in 10 folks with plantar fasciitis can develop heel spurs. Just know that heel spurs doesn't always happen with plantar fasciitis, and just because you have heel spurs does not mean you have plantar fasciitis. It's just one of the clinical findings in some people with plantar fasciitis. You may be wondering what a heel spur is. It's essentially this bone growth that happens at the very edge of the heel where the tissue is connected to the heel bone, and this is from those repetitive microstrains that we talked about that causes bone growth development. In some folks, this can be very painful because every time they step on their foot, they're stepping on this heel spur, which can elicit a lot more pain than just the plantar fasciitis by itself. Do know that plantar fasciitis is a very clinical diagnosis, and it rarely requires some kind of x-ray or imaging, but your doctor may suggest ordering it to see if there's anything else going on, if there's a heel spur. But if you're experiencing plantar fasciitis, you don't need to get an x-ray to confirm that. It is a very clinical diagnosis, and you should be able to be treated for it. So what are some of the treatment for plantar fasciitis? Well, the best treatment is always prevention. So if you're somebody who's experienced plantar fasciitis before, but want to avoid that from coming back, some certain lifestyle changes can make all the difference. So for example, weight loss, the less pressure you're carrying, the less pressure your feet feels. Making sure you're wearing comfortable shoes, making sure you're switching your shoes regularly, making sure that the shoes have good shock absorption, so your arch has a good support. Trying low impact exercises like cycling or swimming over high impact exercises like running or jumping. Avoiding high heels, limiting your walking barefoot, which I am very guilty of. I am Indian, we walk barefoot at home all the time, and I have hardwood floors. So quite often after a day of just walking around at home, I experience the heel pain that I am talking about right now. And quite often I do some of the stretches and exercises that I will teach you later. But it is something, and I can vouch for it, that can certainly cause your pain to worsen. And finally, having a healthy diet, having a diet with less inflammatory foods such as processed foods, refined grains, sugar, can all make your inflammation worse compared to food with healthy fats such as avocados, nuts, and just more fruits and vegetables is always a way to prevent inflammation from building up. Other conservative treatments including rest. If you're experiencing acute plantar fasciitis pain, the best thing to do is avoid the thing that triggers it, so rest your feet. Something else you can do is take a tennis ball and just rub it at the arch of your foot, going back and forth, really digging in, or just putting that tennis ball down and rolling your feet over it can also be a good way to stretch that arch out. Something else you can do is take a bottle of water, don't fill it up all the way, and put it in the freezer, and use that to roll over for about 15 to 20 minutes. And that cold bottle serves double purpose of both having the treatment of the rolling and stretching, but also the ice helps decrease the inflammation that's building up. You can use gel or cushion inserts to put in your shoes to decrease the impact on your heel. You can also get arch supports for your arch, especially if you are somebody who's suffering with low or high arch issues. If you go to the doctor, you may be prescribed anti-inflammatories, so something like ibuprofen or naproxen, which is your Motrin or Aleve, or you may even be prescribed oral steroids, such as like a Medrol dose pack. All of these are to decrease the inflammation that's building up. You may also get a steroid shot in the area of the pain, which is around the heel, which can help take away some of the inflammation also. Other treatment options include physical therapy. You can also be referred to a podiatrist, and they can do conservative treatments as well as surgical. So for example, they can give you orthotics or splints that are specific for your feet. They can also do PRP shots, which are platelet-rich plasma shots, and the way it works is it helps rebuild the tissue regeneration process. So essentially your body is trying to regrow itself and heal itself on its own, and it's a fantastic way of getting treatment, especially if you're suffering with really bad plantar fasciitis. You can also get shockwave therapy or laser therapy, and the purpose of these treatments is to help reduce some of the thickness that has built up on that fascia from overtime inflammation. And finally, for folks who have suffered with plantar fasciitis for over a year with no improvement with conservative treatments, there are surgical options. So there is plantar fasciotomy, which is essentially a cut into the plantar fascia to relieve some of its tension. You can also have a similar surgery in the gastrocnemius muscle, which is your calf, especially for folks who have a hard time with the movement of their foot, and essentially there's a tear that's done in the tendon of the gastrocnemius muscle to help relieve some of the stress, as well as to lengthen the gastrocnemius muscle. So lots of options, and among all these options is osteopathic manipulation. This I offer quite often to my patients if they're willing to take it, and a lot of them feel significant relief while they're in the office, and it's because, as I said, we take our foot for granted. We continue moving around on it, even with pain. We don't address the pain immediately, and over time it builds up. It causes a lot of inflammation, and it makes it a lot more uncomfortable to move your foot a certain way, which affects the muscles around it, affects your lower legs, your thighs, your gait, your movement, which can affect your body. So addressing the plantar fascia as it starts and as it moves on is a huge part of its treatment. So let's get started to see how I do this in the office. But before that, disclaimer alert. To remind ourselves of the anatomy, so here's the calcaneus bone, the heel, and your plantar fascia just goes up and fans out and attaches at the bottom of your metatarsal head, which is at the bottom of the toes. Right here is the arch of your foot, and in my husband's case, he has a pretty low arch. When a patient comes in, I usually do range of motion in all directions to see how much their foot moves. So, move it all directions, rotate it, and then the restriction tells me how to approach my treatment for the patient. And the treatment's not just limited to the foot, but sometimes even the lower legs and the thighs, depending on what I found on my exam. But for our learning purposes, we will just do the foot treatments today. The first treatment I usually start off with is called Counterstrain. Counterstrain is when you find a tender point, which is a pea-sized nodule that is tender to palpation, that is formed due to continuous strain. In this case, in plantar fasciitis, it tends to be closer to the heel, where the area of insertion of the tissue usually lies. The whole point of Counterstrain is applying gentle pressure on the tender point and positioning the tissue of the foot until the tender point is no longer painful. So I apply pressure, I manipulate the foot, I flex it down until that pain is no longer there where my thumb is, and then I hold this position for approximately 60 to 90 seconds. And then once I'm done with it, I gently release and allow the foot to go back to its normal state. You can also find tender points in the calf in a patient with plantar fasciitis and use a similar Counterstrain treatment and release the tension. I use this technique all the time in various situations, and it is amazing to see the expression on my patient's face when I press in that area again and they no longer feel the pain. Instant OMT convert. Next treatment I usually use is called a myofascial release, which I use all the time for my plantar fasciitis patients because it is engaging the tissue that's affected, which is the plantar fascia. And it's a great treatment to release the tension that's built up. This can be achieved by starting at the center of the heel and fanning your fingers from the center to the sides. So essentially you're applying the gentle pressure mediolaterally, which means you're starting the center and fanning your fingers out. And as you do this, you're also moving distally, which is towards the toes, along the entire length of the plantar fascia tissue. This is a great treatment because this provides both a stretch of the tension that's built up in the plantar fascia, but also serves kind of like a massage treatment, taking care of a lot of that pain that's built up. And finally, I'm going to use muscle energy. If you watch my video on carpal tunnel, you may remember this is a technique that you use to actively engage the muscles. So I am going to press up while I have the patient press down. And this counter force allows the muscles that are tightened to elongate and provide relief. So I'm going to press backwards or dorsiflex, and I'm going to have the patient actively engage while they try to plantar flex, which is press down for about 5 seconds. Again, I push it back and patient presses down for about 5 seconds. I ask them to relax and push back furthermore and relax. And this causes a nice stretch of the plantar fascia as well. Now that you've seen some of those treatments done, I want to show you how you can do this to yourself. It's rather easy, especially considering it's your foot. So all you have to do is prop your feet up, put in a relaxed position. And the first treatment was Counterstrain. So we were looking for a tenderpoint. It's a little something that you have to learn to experience, but it's kind of like a knot. You don't always have to have that, but if you have that knot, you just find it and then put your feet in a position where you don't feel it anymore, where it's not tender anymore. And then you press on that area for about 60 to 90 seconds. And as you press on there, you should feel that tenderness go away. Obviously, this is an osteopathic treatment. An osteopathic physician is probably better at doing it, but it is something you can try at home if you need to and see if this is something that's improving. The other thing we did was the myofascial release, where we were going from the bottom of your heel all the way to the top of your foot in that plantar fascia region. So you were applying pressure inwards and out. So you can do this yourself. So you're putting your thumbs, you're crossing it, and you're fanning it out essentially, and you go in the way of the plantar fascia. So you go inwards and out. Inwards and out. And this feels great for me. As I said, I suffer with this also, so this is a valuable treatment. So you're going in and out until you hit the bottom of your toes in the plantar fascia right here. You can also do some stretches, and essentially these are very easy stretches that you can do regularly if you are somebody who suffers with plantar fascia, just to stretch the fascia as well as the ligaments of your feet. So something as simple as just grabbing your toes and pulling them back. So you're pulling, stretching the bottom of your foot and doing that for about 5 seconds, and doing the opposite, where we are grabbing your toes and pulling it inwards, and you are relaxing the tissue down there, and you do the same, but you're rotating inwards. So bring it in and keep it there for about 5 seconds, and then take it out. It's what we call inversion and eversion of your foot. If you were to do specifically the plantar fascia stretch, you would just hold your toes with your hand, and what you do what we call a dorsiflex, which is you are pushing them backwards, and you just make sure that your foot is secure, your heel is secure, and just pushing it back for about 10 seconds. Nice stretch, and relax. Another stretch you can do at home is what we call heel raising, where you're raising your heel for about 5 to 15 seconds. Or you can do what's called a toe walking, where essentially walking on your toes, you can take about 10 steps and then repeat. and you can do about 3 to 4 repeats of this. You can also do the toe raising, which is the opposite of the heel raising. This time you're raising your toes for about 5 to 15 seconds, or you can follow that with the heel walking, where you're walking on your heels for about 10 steps. Again, you can repeat these for about 3 to 4 times. Another stretch is called the calf stretch, where essentially you're extending your calf muscles. You press against a wall and apply pressure on the calf, essentially lengthening the calf. And then you make sure that you repeat the other side. You're holding it for about 10 seconds on each side and doing about 10 repetitions for each leg. It is important to do both legs to make sure that one doesn't get overextended and overcompensated compared to the other side. And you would just repeat it, make sure you're getting a nice stretch of your calf muscle. Earlier in this video, you've seen how to stretch your plantar fascia using a tennis ball or a frozen bottle of water. Something else you can do to strengthen the toe muscles and the fascia is picking up a towel with your toes. You can also replace that with marble, where you're picking them up with your toes and dropping them and repeating this a few times. I hope you found this video useful, especially if you're suffering with plantar fasciitis. Please try some of those stretches. Of course, before you try any of the osteopathic treatments, consult your doctor. Make sure these exercises and treatments are right for you. There are other things that can give you very similar pain, and you want to make sure that you are truly experiencing plantar fasciitis and not something else. If you have any questions about the treatments or any questions about plantar fasciitis in general, please leave a comment and I'll try to answer it as soon as I can. If you like this video, please give it a thumbs up. If you haven't subscribed to my channel, please subscribe so you can get these bi-weekly videos about health and how to take care of yourself. Until then, please take care, stay safe, and I will see you next time at Do It Right with Dr. Ansu. Bye.